I work with the NITI Aayog, with the Vice Chairman, Dr. Rajiv Kumar, and also currently working on the whole COVID response with the chairperson of the National Task Force, Dr. Paul. And my background is in healthcare, life sciences, public health. I've worked in different capacities prior to joining the NITI Aayog, where I've been there over the last 5 years, working on a range of healthcare related policies, and obviously also looking at sectors like pharma. Thank you. Yeah, so I think it's firstly very important, when we talk of policy, to see the sort of context that we are operating in and the sheer, scale and depth of challenges, as well as now opportunities, because the post-COVID era also brings a host of opportunities with it in terms of widespread adoption of technology, digitalization, etc. So I think we need to first see that context, because, policy changes and impact don't always happen overnight. It's a fairly long-term process. So we must get that context right when we're looking at it. So I think if we look at the medtech space in India, and a lot of this has been pointed out, but it's not just import dependency. We have various other issues that obviously we need to tackle. We are also at the lower tech end when we look at most of the domestic manufacturers, and the higher end devices are mostly coming in from the multinational companies who have extensive service networks here. Most of the Indian manufacturers are also still MSMEs, and so there is also, of course, an issue there of scale and also turnover. So that is also something that we need to be looking at here. And when we look at the challenges for this sector, there's of course a whole host of challenges. There's cost. There's also the infrastructure, the supply chain logistics, the cost of finance and power, all those kinds of things, and also research and development. So we're looking at a very broad gamut of issues to be addressed, first of all. And I think that is something which is important to acknowledge. And a lot of these have been around for years. These are not some things which have been around for just a short span of time. Now, in the medtech space, in the policy space, we started from a truly fairly low base. For the longest time, even in the regulation, in the policy space, med devices were not even seen as distinct from pharma. There was one big category in which everything was lumped. So we had to start right from that level, where we had to bring in separate recognition, firstly, for the medical devices rules. So, we've brought in certain categories. We've brought in the National Essential Diagnostics list. So these are all steps forward. These are not perfect. A lot more needs to be done. But at least they are steps forward from where we started. We started at a very low base, and that's important to point out here. Of course, the PLI schemes, again, there's always room to do more. And I think that's always the case in policy, that you can always bring in more. The medical devices parks that, we're looking at, so very much like the Andhra Pradesh Medtech zone, we have some good, experiences coming out of that. So we're also trying to look at that in various other states, in Andhra Pradesh, in Telangana, Tamil Nadu, Kerala, etc. So a lot of that effort is also on at this point. And we're also looking at the possibility of research-linked incentive schemes. So not just the PLI schemes, but we're also looking at how do we really bring in the cutting-edge research and development and innovation, and also move us more towards the higher tech end, as I said, rather than just remaining in sort of the class A and B space of devices as we, historically been in. How do we also move that up further? So we're also looking at the possibility of bringing in additional schemes here in research and on providing incentives for that. So I think there is a lot of action happening. I think, I wouldn't look at it with pessimism that, we haven't done enough. Rather, I would say that we have moved the needle forward considerably from where we've been. Is our work done? Absolutely not. We have a lot more to be done, but it can only happen through a public-private partnership mode. We cannot have this, this constant distrust between the government and the private sector, and I think it works both ways. So I think both sides will need to work together. rather than always questioning or doubting one or the other, because that's not the way we can move forward. And we have such a huge gamut of challenges to address. So I think that's what I would say, very broadly speaking. Yes, there are a lot of other schemes. You mentioned the Digital Health Mission. There's also Ayushman Bharat. And I think a lot of these at some level do impact this whole space. So with the Digital Health Mission, we're obviously trying to, again, bring in the whole focus on digitization there, as well as use of technologies, as well as use of artificial intelligence, etc., within our healthcare ecosystem. But of course, it's important to remember that it has to be very usable and practical. Much of India doesn't live in just tier one cities. Most of India is going to hospitals like Apollo and Fortis. So whatever technologies we bring in, whatever we talk about, has to have the potential to eventually reach the last person out there. So I think that is something that we need to make feasible, even as we talk of all these big technologies and all these fancy terminologies. So I think that is something that we are looking at very, very carefully and very, very seriously at this point. And also Ayushman Bharat, we have a long way to go there as well. And I think this is again something that we cannot do without a partnership, between the public and the private sector. Because we need to move it away. We have a lot of focus on tier 1, tier 2. We also need to go to our tier 3, tier 4. How do we make it viable there? How do things work out that we actually provide services there at a costing which works for everybody and is ultimately also affordable for the people? So I think there are many, many issues that we are looking at and we are working on. But overall, I would say that a lot has been done. There's a lot of interest in this sector that I have seen just over the last few years. As I said, we've evolved from a fairly low baseline of how we used to look at the sector, even in the policy space or the regulatory space. So I think we need to keep moving forward, but it will only be through partnerships and through a greater trust between both the public and private sector. So I think that is the way that we will have to use to move forward and to make use of the massive opportunities that I think the post-COVID era has created for this sector. Using digital technologies in general, yes, because as government we are looking at training in a much broader sense. So definitely that is something that also in the last year, because we could not actually do physical trainings, we did use a lot of digital platforms. We did use a lot of video modes, etc., to make sure that we could do training of master trainers, for instance. And even now in the vaccination drive, we are continuing to use a lot of this approach, because it's becoming increasingly very difficult to have physical, in-person, large-scale trainings. So I think in that context, this is something which has taken, it's definitely accelerated, but we have also started looking at it, before the pandemic, in the context of our health and wellness centers, for instance. Where we need to train, the staff there on aspects like non-communicable disease screening, because a lot of these centers and our primary health system in general has been geared up towards reproductive, maternal, child health services, and so a large part of our workforce in the primary health system in particular, and then when we look at allied health professionals, etc., as well, are not actually equipped to necessarily provide a lot of the services which we are now supposed to provide through these health and wellness centers. So the non-communicable diseases being one of the most important there, the geriatric care, mental health, etc. So definitely we are looking to use these sort of online platforms more and more to be able to provide these trainings, to standardize the trainings. Again, standards there, quality there becomes a very important aspect. Because you can perhaps bring in greater standardization if you use these platforms, and then eventually, of course, also look at it in different languages, in sort of different shapes and forms that actually works for the very diverse population and also health workforce that we have. So I think we've made a start, and as I said, there was some amount of fillip that we got because of the pandemic, that we had to use these channels much more. But I think we will see that continuing into the future, and we will see it being used for different purposes, and also bringing in those standards and bringing in those quality aspects, as well as making sure that it reaches all parts of India, because it cannot be just one or two languages, or in something which reaches only a small proportion of the population and the workforce. So I think with all these factors in mind, this is something that we will definitely see the government also adopting at much greater scale in the time to come.